Hi, my name's Taylor and this is the HEENT video assessment. I've already provided privacy, completed hand hygiene, and introduced myself to the patient. I'm going to ask her some things about herself. Hello, can you tell me your name and date of birth?
Yes, it's Angelica, and my date of birth is June 11th, 1990.
Okay, and then can you tell me where you are?
I am at Research Medical Center.
And then what's the date?
The date is Wednesday, November 21st.
And what are you here for?
Pain in my ears.
Okay. The patient's alert-oriented ×4 to the person, place, time, and situation. She's dressed appropriately for the weather, and she's a 33-year-old Caucasian female. So can you tell me when the pain in your ears first started?
It started about 2 days ago when I got in town from Denver. I'm here for the holiday weekend.
Okay. And then you say the pain's in your ears. Can you kind of describe where in your ears? Is it
Just kind of like deep down in my ears.
Okay.
And, yeah.
And then, and then how long has the pain in total been occurring for?
For like the last 2 days. Probably started like a day after I got here.
Okay. And then can you tell me what type of pain you're experiencing?
It's just kind of like a pressure, like a pressure pain, I guess. More annoying than anything.
Yeah. And then have you tried anything to make the pain go away, feel better?
I've taken some ibuprofen and it's kind of helped, but then it just kind of comes back.
And then is there anything that you've noticed that makes the pain worse?
Not really, no.
Okay. And then does the pain radiate anywhere else besides your ears? Okay.
Just my ears.
Okay. And then how long does the pain usually last?
It's been kind of consistent. I get a little bit of relief from the ibuprofen, but then it kind of just is back again.
Okay. And then if you could rate your pain on a scale of 1 to 10, how would you rate it?
Probably a 7.
Okay, pretty bad. Okay, so according to the history that the nurse took, and correct me if I'm wrong on any of these, your allergies are just seasonal allergies controlled by over-the-counter meds, and then you take birth control daily and a women's daily multivitamin, okay? And then big medical history is really just chickenpox as a child and eczema, okay? And then only surgical history is you got your wisdom teeth out,
Yes.
okay? And then social history, looks like you work as a teacher at your home in Denver.
Yes.
You're in town visiting your family for Thanksgiving. You work out with your husband. You recently moved into a new home. You don't smoke, no illicit drug use, just drinks wine on the weekend. And then really your last travel is just flying here. Okay. And then as for family history, it says your mom just has hypertension. Your dad doesn't have anything. You don't have any siblings. And then your aunt had breast cancer, and your parent or your grandparents are deceased. Okay.
Yes.
I'm going to ask you a few more questions. Have you noticed any weakness, fatigue?
I've been a little bit dizzy, I guess, like up kind of here and there. I just kind of noticed I'm a little bit more dizzy.
Have you had a fever? And then have you noticed any big weight changes, like loss or gaining?
No.
Okay. And then you said you noticed some dizziness. Do you notice like a headache or anything like that?
Okay. Not really.
Okay. And then have you had any recent trauma to your ear that you can remember? Okay. And then have you noticed a decrease in your hearing?
A little bit. I mean, just kind of off and on, I guess. I don't know. It seems like I kind of have to work a little harder to hear things, I guess.
And then what about ringing in your ears?
I've noticed it maybe once or twice.
Okay. And then have you noticed any discharge from your ears? Okay. And then just ask for some other questions. Have you noticed any vision changes? Have you had a runny nose?
No.
Have you had a sore throat?
No. I mean, I've been a little bit stuffy, but not anything.
Okay. Awesome. And then as for, have you noticed like a change in your mood, attention span, speech, nothing?
No.
Okay. And then you said you've had some dizziness. What about numbness or tingling in your extremities? Okay. And then no tremors or involuntary movements that you've noticed. Okay. So it looks here that your vital signs say you're 124/78, your heart rate 67, temperature's 97.3, respiratory rate's 18, and her O2 sat was 99%. Okay, now I'm going to continue with the assessment portion. The first thing I'm going to do is just listen to your heart, so you can just relax right there. gonna press a little hard. And normally I would, if she had a gown on, I would listen under the gown. Sorry.
You're fine.
Okay, so S1 and S2 was heard, and then there were no murmurs, bruits, or rubs that were noticed. Looking at her lungs, her chest expansion is symmetrical. I don't notice that she's short of air or having any difficulty breathing. So I'm going to go ahead and just listen to all her lung fields. Anterior. You can take a big deep breath. Good. Good. And then I'm going to move to the posterior lung assessment. And if you just want to take a big deep breath. Good. 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 Okay. So everything in her lungs sounds good. I don't hear any wheezes or anything that would cause concern with her breathing or her lungs. The next thing I'm going to do is go ahead and assess each ear. The first thing I'm doing is just inspecting them. I don't see any discharge, abnormal discharge, or anything that's causing me concern. They're lying in the right place. I don't see any, obvious trauma or anything like that. Nothing on her external ear that's causing me concern. And then I'm going to go ahead and using my otoscope look in each of her ears. So I'll turn it on here. And then you can just relax. Maybe pump this up a little bit. And then I'm just going to pull back a little bit to straighten it out. Okay. So her left ear is free of foreign bodies. There's no abnormal discharge. The tympanic membrane is not perforated. I have noticed a little bit of hemorrhagic content behind the tympanic membrane. And then also in this tympanic it's just slightly swollen, the tympanic membrane. And then I'm going to move on to this ear, same thing. Pulling back on the ear to visualize it a little bit up. Okay, so her right ear is free of foreign bodies, no abnormal discharge. Same with this tympanic membrane, it's slightly swollen, and I've noticed a little bit of hemorrhagic collection behind her tympanic membrane. So since she said that she's kind of noticed a little decrease in hearing, I'm going to go ahead and perform the whisper test to see if she states what I'm whispering back to her correctly. So I am going to have you, I'm going to push this back, and then if you just want to sit here. Okay. And then I'm going to be about 2 feet behind her. I'm going to occlude, oh sorry, I just shocked you. I'm going to include the non-testing ear and kind of rub the tragus just a little bit. And then I'm going to whisper 3 characters, and then if you'll just repeat them back to me. But obviously close your eyes since we're looking in the video because I want you to see. Okay, if you want to repeat those back to me.
EU3.
Okay, and then I'm going to repeat the same thing on this ear. I'm going to occlude it, and I'm standing about 2 feet back. You can close your eyes just so you can't see mine. Okay, can you?
S1. I don't think I heard the last one.
Okay, all right. You can take a seat back here. Okay, So after the whisper test, she did pass it. She did miss 2 of the characters in it, which could be possible due to her diagnosis that I'm about to explain. If she would have missed 4 out of the 6 characters, I would have continued on and completed the Weber and the Rhine test to assess her hearing loss that she says she kind of has on and off. So moving on to my differential diagnoses, I have 3. The first one could possibly be otitis media due to the tympanic membrane being slightly inflamed. I would rule this out just because she doesn't have any associated symptoms of that. You know, no really runny nose, fever, or anything like that. There's also no fluid present in her middle ear, which would be suggestive of an ear infection. The other differential diagnosis is mastoiditis, which makes me think that possibly she could have this due to her ear pain. I'm ruling this out just because she doesn't have an associated fever, and then usually she says her pain's constant, and with mastoiditis, the pain is usually worse at night. And then obviously I didn't notice any deformities of their mastoid bone or anything that would cause me to think that she has this. My main diagnosis for her is barotrauma due to the fact that she just recently traveled. The onset came about 24 hours after she landed here in Kansas City. Also, the hemorrhagic collection behind the tympanic membrane is suggestive of barotrauma. The dizziness and then the slight hearing loss is also suggestive of barotrauma. And then the final thing would be it's only been occurring for about 2 days. Usually it'll occur for a few days and then possibly correct itself. But my ruling is that this patient has barotrauma. Thank you.